Hi, Dr. David.
Hi, Tammy. It's good to see you here. I'm glad to be here. It's been quite a busy day. So anyway, yeah, for people that don't know me, I'm Dr. David Fawcett, Vice President of Clinical Programming at Seeking Integrity. My specialty is chemsex, the kind of fused co-occurring drug use and sexual behavior. And if you don't know it already, you should have this fabulous book, Lust, Men, and Meth, Gay Men's Guide to Sex and Recovery, also available in Kindle or audiobook.
And tell us about the book you're working on, because I'm thrilled to have this one coming
So actually,
out
there's
too.
two books in the works. The one, Scott and I are basically redoing this book, which is for gay men. But the complication of this book is that it's 90% of the material is universal. But the clinical work I'd been doing was with gay men. So the examples are with gay men, but we're rewriting basically a chemsex book for everybody. For men, women, gay, straight, doesn't matter. And it really doesn't. It's all the same addiction and addictive behavior. So that's what we're trying to do. So that one's coming out. And then also there's a sex and recovery workbook I'm doing coming out, both next year, hopefully. So, yeah.
Well, and before we get really going, I love that you're offering a work group. So for 4 weeks, a series of 90-minute sessions that are opportunities for people that are struggling with co-occurring, to connect with you, hear some lectures and things, but really have discussions about that. So it's not therapy, it's not treatment, but that has been a great supplemental support, I think, for helping clients. In addition to the Sex Addiction 101 work groups, which have been doing really well. Right. I hear rave reviews about both. So
yeah, it's been fun for me and it's been really useful. We're getting people from all over the world. Actually, there are 4 90-minute workshops once a week. We're in the middle of a series now. We're going to do another one in January, and I go into some detail on the whole idea of chemsex from soup to nuts, I guess, from the origins of it, the behaviors, the expression of it, and the recovery. And so it's nice. There's small groups. We have a lot of time for interaction. So it's been really terrific. It's been really fun.
Yeah, and I answer the phone a lot, so I hear the questions, and so many people have gone to treatment for chemical addiction and they have relapsed and they're really struggling. And so I think looking at this holistically, whether it's cannabis, stimulants, opiates, alcohol, I mean, we have a lot of people who are using some form of chemical in addition to the sexual acting out behavior. And so being able to look at it holistically, which is what we do in our treatment program, is really critical for people to really heal and not just keep using one form or another of an acting out behavior.
I think it's such a disservice in general that the field basically is so kind of segmented. They treat drugs or they treat behavioral addictions, but most people have both. And so, we get a lot of people coming for us to treatment who are long-term recovery from drug and alcohol, but their sex addiction has gotten out of control. And as you know, I'm in recovery from alcohol, and I look around an AA meeting, or probably half the people are sex addicts or porn addicts, untreated. So yeah, it's a big issue. It's a big issue. And I think I call it the kind of whack-a-mole syndrome. I can get my cocaine problem in shape or alcohol, and then porn pops out or gambling. And if you don't treat it all, we're really doing a disservice to clients. And that's the whole, I think, beauty and what makes us unique really at Seeking Integrity, for sure.
Yeah, I agree. So,
yeah.
So what topic are you planning to share tonight?
Well, I wish I had a more developed topic. Because I literally ran out of time. I have not been offline for 8 hours, but I want to share something that just kind of blew me away. And it's from my friend Leah, who I see is actually here, who is involved at the UCLA Addiction Studies program. And he sent me this little tidbit yesterday. And it came up today in our group too, at Seeking Integrity. We're talking about the power of cravings and how with these intensity addictions that we see, sex, porn, chemsex, they all are what we call super stimulants. They affect the dopamine in such a dramatic way and actually qualitatively different than other addictions, that once we get that cue, once we're triggered for whatever reason, it's really, really hard to resist. And part of that's because if the cue is kind of like a go signal, our brakes, our stop signals are kind of offline. Our frontal cortex in addiction gets kind of disconnected. And so we have all this impulse and no real way to control it. But this is from actual research at UCLA And it just struck me, it compares the relative size of cravings. These are from fMRI studies. And basically there's 3 examples. If you're dehydrated and need water, the relative size, just a starting point, is the size, say for comparison reasons, a baseball. So if you're thirsty, you're dehydrated, you need water, the size of that craving you're going to experience is the size of a baseball. If you're starving to death and need food, the relative size of a craving is the size of a basketball. So it's significantly more than it would be for water. But, and remember, this is based on brain scans. If you're a drug addict or an addict, and you start thinking about your addictive behaviors or drugs, it's the size of a baseball field. Now just think about just for relative terms, baseball, basketball, baseball field. So it's enormous. And that's kind of gives you just a sense of the fight that addicts are up against when they get triggered with these cravings. It's huge. And so I think it's really important for us to talk about ways to manage that. I think the best thing we can do is to avoid triggers, obviously, if we can, but many of them come from inside, their feelings, their beliefs about ourselves, and those we really have to quickly learn how to diffuse. So that just struck me as just amazing and just important to, and I think always I think that's helpful for people to understand that they're not just bad people or weak people, but these are real strong cravings and impulses when addiction takes over our brains. And that's, I think, a great example of that. So anyway, that's pretty much all I had. Maybe we'll have some questions.
No. I love that. And I had no perspective on that. I mean, I'm on a number of Facebook recovery groups. But that's been meaningful to me. Keeps me plugged into where I was, and I can hopefully sometimes give support and things like that too. But I hear constantly people, oh, I gave into the craving, and the shame, like that they're so shame-filled that I just like the craving is so bad, I just can't stand it. Well, this makes even more sense to me now, but also that, or I gave into it, and I'm such a loser, blah blah blah, so I think that perspective is really helpful. And I know you're doing a podcast with Lulu Cook, and she did a great podcast with Dr. Robin. She did a Super Saturday Recovery Summit, but she talks about food and how some of the foods that we eat can reduce our cravings. And I think about, like, I don't know, because my previous thought was, well, if we can, give ourselves a little more bandwidth, but if it's a baseball field, I don't know how much we can condense that down to a basketball or baseball size. But even if we just have a little more bandwidth, if like you talked about, okay, if I'm thirsty, and I'm hungry, then I'm, I already have some cravings going. So if I, we talk in AA about hungry, angry, lonely, tired, I add stressed, but if we're doing some things, then we have a little more resistance to, some other cravings. If we're, I know for sure when I'm really tired, I have less bandwidth. I know if I'm really hungry, so it's taking care of myself holistically, so that I have a little more, I have, that extra second to think about, do I really want to do that? That can give us a little
that emotional resilience is so important to have too. And I think we do get run down, and that does create a problem for us, for sure.
Yeah. So I don't see any questions. Does anybody have questions for us? Oh, I lost you.
Good question.
Okay, now I hear you. Oh, there we got a question. Okay.
Oh, good.
Okay. My husband is a porn addict, sober since the beginning of 2020. Last week, he watched many YouTube videos of naked women for 4 days. I found this out on my own. He did not tell me. He is convinced he is in recovery. He has a sponsor that he infrequently speaks to 1 to 3 times a month at most. He blames me continually when we meet with our couples therapist. I am so confused. Is he in recovery or in his addiction?
Wow. Well, there's quite a few things in there that would indicate that he's struggling quite a bit. I think, first of all, 4 days of watching videos is disturbing and obviously not a recovery action. The secrets are an important piece as well. I think one of the things we always teach, if you're in recovery, you need to come clean and come clean quickly. Because that living in integrity is just an essential part. If we start compartmentalizing and playing games with that, as addicts are prone to do, it can really be problematic. And then, speaking to a sponsor infrequently, 1 to 3 times a month, just doesn't do it. And then on top of that, blaming. So every one of those symptoms, to me, is an addict who's, I think, kind of raging in denial, acting out, and looking to spread the responsibility anywhere else but on himself. So I think there's a lot of problems. Based on this, I don't even think it's kind of even close to recovery that I could put in any kind of terms at all. So I would really be concerned about that. Every sign there is a troublesome one. And so what can you do? So I think it's important for you to have boundaries here and maybe set some boundaries and limits of your own, to not accept blame or responsibility or whatever else he may be throwing at you. I think that's a natural thing that partners do sometimes. Well, maybe there's some truth to that, and no, there's not. He's looking to deflect from his own behavior. And so I would really, at this point, not get into a real argument with him or a controversy or try to talk him into it, but really just take care of yourself at this point. Get support for yourself. Share this experience with other people, other partners who can maybe give you some advice on what further things you can do. But I think sometimes when we're in the midst of somebody who's active in their addiction like this, it does get kind of foggy and we start to doubt ourselves, and especially if there's been a history of gaslighting and all that. But this behavior is very clear, and it's not behavior that I would call in any way recovery. So
yeah, I agree. And I'm looking at, so I'm curious about the couples therapist. I don't hear that he's got his own therapist to work on addiction recovery. So that to me is a problem. I hear that he's only talking to a sponsor infrequently, but I don't hear any other recovery work. I mentioned at the beginning of the time, we have the work groups for men. We have 4 drop-in groups for men every week, free. We've got this. First of all, let me back up. I'm so glad you're here. Ads, we both have our CSAT therapist. Okay, so that's good. I'm glad. Hopefully your CSAT therapist is supporting you in a pro-dependent manner, meaning you're not codependent, you're not part of the problem, you're not, all that. But, when I think Dr. Rob said it, I do a lot of these webinars, so pardon me if I misquote, but, when 2 of you are showing up for therapy and only one of you is telling the truth, that's like trying to row a boat with only one oar. You're just going around in circle. You're coming there trying to work on the relationship, trying to be honest, trying to do things, and it's not working. So until he has solid time in. So I always look at it as abstinence is just not acting out. And then there's sobriety and you're kind of finding your way. And then recovery is when you notice that he's changed. He's showing up, he's being more honest. He's trying really hard. If he hasn't read Out of the Doghouse yet, you read it, but then, give that to him as well. That's how you start rebuilding trust. The blaming, that is part of gaslighting, and that only serves to, take the focus off of him. I'm really disturbed that he didn't fess up to you that he did this, and that he somehow believes he's still in recovery, even when that's problematic behavior. So,
sometimes I want to just talk about the role of therapists in here for a minute, because it can sometimes seem kind of therapist heavy, but we've found based on experience that it's best for each person to have their own therapist, because there's very different processes for the partner to deal with the trauma of their experience, and the addict to deal with their experience. And it's actually 2 different timetables of recovery, 2 different tracks, and people really kind of need to operate somewhat separately with their therapists. And then very often though, and this is where it gets to be a lot of therapists in the room, sometimes it's really useful to have a third couples therapist. And this person clarified later that they do indeed have their individual therapist, but oftentimes it's important to bring that third couples therapist in, whose responsibility is neither the addict or the partner, but the relationship. And that's really important, because the therapist who is responsible for any one of the individuals, it's a little bit of a conflict of interest to have the couple as well, because if I'm treating the partner, where's my allegiance when the couple comes in? And clearly a therapist tries to be neutral, but if nothing else, it gives a bad impression. So that's why there can be so many therapists involved, but it does really end up being helpful, I think, especially if there's a disclosure process.
Well, and I neglected to mention there's betrayed partner groups. So tomorrow morning at 8:30 in the morning, we have a new betrayed partner group. So please get support there. Sunday night, Wednesday at 12:30, all Pacific time. But there are so many opportunities, to plug in and get support for you, get validated. No, he's lying to you. He's hiding things. I mean, it isn't you. It's it's his behavior. So. Okay, next question. Recovering SA, struggling with a new co-occurring addiction with food, binge eating, drinking as a new numbing techniques. My psychiatrist wants me to try Vyvanse to manage. Do you have experience or opinion on pharma solutions like this?
Yeah.
You're asking the right person.
So Vyvanse is an amphetamine, often used to treat ADHD, that's where I see it most, but it's used generally to treat some other things in terms of mood. So we're talking about sex addiction, co-occurring food, binge eating, drinking, and I'm really glad you identified them as what they are. They're kind of new numbing techniques to kind of disconnect or dissociate from those feelings. And that's, feelings are, obviously I would encourage you to deal with the feelings themselves and not medicate them. However, to go specifically to your question about Vyvanse, I do get concerned about Vyvanse and Adderall and Ritalin and other prescription amphetamines. We know that they are easily abused. I have had the experience with especially stimulant users and intensity addicts, and I would include porn and sex addiction in that. They all kind of fit into this arousal side of that reward center where we're kind of seeking intensity and stimulation, and amphetamine is a natural to do that. And that's why people are drawn to cocaine and methamphetamine. But for the body, in many cases, especially if people take more than they should, the body doesn't really know the difference between Vyvanse or Ritalin or methamphetamine. So I think it's really dangerous in terms of, given all this kind of cluster of stuff you're already doing, that's going to give you another one, another mood altering drug that is often used in conjunction with sex addiction and to change mood and to increase intensity. So frankly, I would shy away from it. There are other alternatives for ADHD. There are non-amphetamine medications like Strattera that work slightly different, but they do work. And there's other options depending on what he wants to do for compulsive behaviors, which is what I suspect he's doing. But there's SSRI antidepressants, which are very common. They're non-mood altering. They're very safe. Usually a general physician can prescribe them. So I'd just be really cautious about Vyvanse. It's a very strong drug. It's an amphetamine. And for anybody who has addictive tendencies, which you do, I think it's certainly not the first choice. I think it's a bad choice overall.
And I'm going to request that you seriously consider what we do in our treatment program as we address the underlying issues. So it isn't just the whack-a-mole of going from one thing to the other and always looking to numb out, that is, true recovery, for which I'm so grateful to have experienced, is so worth it. And you can't experience it if you're always, just moving from one thing to the next. So, please consider, getting a higher level of help. We safely cocoon the guys. They get a chance to really look at it's, is it fun? No, but gosh, to leave, after 14 days or so and be on a different foundation, it's a gift. So please consider that. So, okay, next question. My SA's affair partner literally lives across the street from my office. Oh my gosh, I am so sorry. I'm triggered daily, several times a day when I get to the office and leave the office. It's a daily reminder of the secret I carry. What can I do to make my stress less each day? I am 3 years from D-Day and the affair partner is recent as the beginning of this year.
Wow, that's a really tough situation. We know that there are different triggers, talking about triggers earlier, that and places like that, geographical places, offices, visual reminders of the addictive behavior can be really disturbing. And so I'm just really sorry that you have to kind of confront that every day, 3 years from D-Day, and the affair partner is recent. So yeah, so it's gone on. So boy, I don't have great advice for you. I think I would, what is going to happen is that you're going to be triggered and you're going to have a lot of feelings. So I would really manage how you're dealing with those feelings. I would certainly express them, not sit on them, but I would have a safe place where you can talk about this and process it and release it. I think the danger for you would be to sit on those feelings and then, because feelings will leak out if we don't kind of properly process them. And so I think it's really important for you to kind of experience them and talk about them. It does occur. You can kind of weaken the power of those triggers sometimes. So I think sometimes if you talk about it with someone enough and maybe have an approach toward managing it, I think it's going to maybe lessen the impact, the disturbing impact. There's no way I think to eliminate it totally, but I would take an I would actively engage with it, if you know what I mean. So what do I mean? I mean, don't just kind of pretend it's not there, don't ignore it, but you need a sense of control over the situation. And the way you get a sense of control, even with something like this that you can't really control, you can't move it, what can you do about it though? You can face your feelings, you can confront, there it is, you can kind of be in charge of how you react to it. That's probably the extent of the control you have. But that assertion of some influence over it is really important, as opposed to just kind of feeling powerless or victimized by it, but just kind of do something to engage with it and minimize the impact. I've had clients sort of try to make jokes over, puts it in a funny light or try to reframe it or reframe it in some healthier way. It's a hard thing, but I think it's important not just kind of pretend it's not there or to kind of be disturbed that it's there, but to really manage how you react to it. And I wish I had better solutions for you, but I think any sense of control you can have over that would be important.
Yeah, I thought, when people have discovery that their spouse or partner has had someone in their home, in their bedroom, I'm like, redecorate, take over, take control, like you're talking about. This is such an external thing. And I'm going to share this. I don't know if it'll be helpful, but my therapist, does some EMDR with me, and even over, the computer, it's been helpful. But I'm wondering if doing some EMDR around that specifically. But then she taught me, like, I can do it to myself, and I have a, I am worthy. I have a whole little mantra that I can say. And I wonder if, as you're sitting in the car, if you're able to do something like that, have an EMDR, and then do that, with facing, this situation, facing the affair partner's, residence, if that might be helpful. But I so appreciate what David said, is like, take it on, don't try to tuck it away, because it'll keep festering, I think. Don't you?
Yes, Tami, that's a really great idea, because EMDR, which is a trauma therapy that a lot of people do, it has a part of it is called resourcing, and where you can kind of resource, and that's basically internal skills to manage feelings, to process them, and to kind of reassure yourself, and that's a great idea. So I think those kind of skills, grounding skills, visualization, all those to kind of center yourself again, even in the confronting this kind of unfortunate thing across the street. Yeah, great exertion.
And I hope your essay gets help so that he doesn't continue to keep traumatizing you. So, okay, next question. Can you explain how we could use CBT when we're triggered? What are examples of alternative thoughts, emotions, and behaviors that we could turn to, and how do we implement them? And explain what CBT is.
Yeah, so CBT is not oil that we use.
I know, I was thinking, because I want to make sure we're clear on that. So
right. CBT is cognitive behavioral therapy, which is the kind of classic standard psychotherapy approach that kind of is the bread and butter of a lot of psychotherapy processes. It means basically we look at our thoughts and how we frame our thoughts and the beliefs we have about things and ourselves, and those actually kind of impact the emotions that flow from them. And so we can, by changing how we view and interpret things, we can actually change the resulting emotion that comes out. So some examples, I like to use the notion of cognitive distortions, which is a big part of CBT. So a cognitive distortion are mistaken beliefs that we all have, and we all have them, but we all have our favorites too. So an example would be black and white thinking. So, you know, we tell ourselves stories, right? So we tell ourselves well, my choices are this or that. You know, I can drink or get divorced. Well, no, there's probably a lot more choices in there that we could do. So black and white thinking is kind of a trap that we talk ourselves into. So if we can realize that, hey, I've just framed this in a way that's very limiting, maybe there's another way to approach the situation. Or other things would be denial is a cognitive distortion, minimizing, catastrophizing. You know, oh my God, I broke a nail, you know, I'm gonna die.
I could see you reacting like that, you know, just having a complete meltdown. So.
I'd rather just chew them off, but yeah. Okay. Minimizing, catastrophizing, black and white thinking, jumping to conclusions. You know, Tami just looked at me cross-eyed. She must hate me. You know, I gotta go. I gotta take my ball and go home. That kind of thing. So we do it to ourselves in many cases, where by framing things in a certain way. And once if you just Google cognitive distortions, you'll see a wonderful list of them, and it's really helpful to kind of just have them in the front of your mind, where you can say, gee, I just did that one, and just kind of correct yourself. And just by kind of being more realistic about our options, about what the real situation, the real threat of things, the real choices, how we may be over catastrophizing something or minimizing something. You know, gee, it was only cocaine, it wasn't meth. You know, well, that's a problem. So there's all kinds of examples. So I think if you can understand that and then reframe it, oftentimes the emotions that flow from that will be helpful. The other thing I want to mention is that with these intensity addictions that we treat at Seeking Integrity, which is the chemsex, the sex addiction, porn addiction, in recovery, those are so intensive and stimulating that the brain actually kind of resets to accommodate all the stimulation coming in. And in recovery, there's a kind of a lag time as the brain is readjusting back to normal levels of stimulation. And during that time, our ability to kind of be clear and be thinking clearly is a little muddled sometimes. We kind of fuzzy thinking. If you're in recovery, you might recall in the first couple months, you're kind of, you know, I couldn't figure out, I talk about, I got sober in New York City, and there was a choice of 4 meetings in my neighborhood, and I couldn't decide which one to go to. And I remember, you know, basically standing on the street in the Upper West Side, crying in tears because I couldn't figure out which meeting to go to. And that was kind of sums up my mental state for a few months in early recovery. So I always caution about doing CBT on people brand new, because it requires a little bit of mental agility, and sometimes we're just too scattered to do it properly, but it's a very effective technique normally. Yeah.
And I was thinking very early on, especially asking a trusted other, you know, like I'm standing on the street corner. If I asked my sponsor, which meeting should I go to? The closest one, you know, I mean, whatever's going to get you to the meeting the fastest, you know,
right.
but with a lot of those things, you know, the story I'm telling myself, you know, I can still check in with people and go, the story I'm telling myself is this. Well, that's not, you know, but I was having a little panic when David wasn't right on time. And I'm like, the story I'm telling myself is he's not going to show up. And I'm going to be, I mean, like, boom, you know, and I have to, yes. And I have to just, you know, dial it down and go, no, there's probably a legitimate reason. And like, you know, just, you know, so I try to be curious and use this part of my brain instead of the, oh my gosh, you know, part of my brain. So, but a lot of it is, you know, ask somebody, you know, like just take a moment, even taking the moment to ask somebody, you know, here's what I'm thinking. You know, here's what I thought, whatever, is this a good choice? You know, that gives me the moment of pause to not just react.
Right. And remember, when we're in that state, it's a closed universe. We're in our own head. There's no new information coming in. So we're taking it's like anxiety is very much the same thing. It gets trapped in our heads. We spin around, get worried, work ourselves up, but there's no new information coming in. So we don't ever veer off that course. So I think Tammy's suggestion is wonderful. Just get some input, ask for help, which
Yes.
is an addict. That's not our first thing we think of, but that's
No.
a very effective tool.
The scariest place is between these two fingers, like that's if something's caught in there, it's in the squirrel cage of things, and I'm bouncing things back and forth. I'm not going to make good choices. I'm going to skip to this one. What is EMDR? Because we just talked about it. So can you elaborate on that a little bit more, please?
Yeah, thank you for the question. I forget. So EMDR is this real mouthful of words. It stands for eye movement, desensitization, and reprocessing. That's why we call it EMDR, because it's a mouthful. What it is, it's a really powerful trauma technique that was discovered accidentally. It's approved by everybody, including even the VA, for trauma therapy, although we don't totally understand why it works or how it works. But basically the idea is that by increasing what we call bilateral stimulation, which is the two halves of our brain talking to each other, that actually helps the brain do what it knows how to do normally, which is to process memories, including traumatic memories. When we have trauma, those memories don't get adequately processed and they get kind of stuck. And then if we get triggered, they get activated. So we re-experience and relive and have flashbacks and all that. So EMDR, somehow by stimulating two halves of the brain back and forth, left, right, it somehow allows the brain to disassemble these traumatic memories and file them away as they should be filed away. So how do we do that? It was discovered by accident by this woman named Francine Shapiro, who I think she was in some kind of life crisis, and she was walking either on the beach or at a lakeside, and she was like looking to the woods and looking to the water and looking to the woods, and suddenly she realized she was starting to have some movement in these memories, starting to feel better, and just basically started to play with that. And the original EMDR eye movement was basically looking left to right, which is really hard on your eyes if you're doing it. And it's also very hard on the therapist, whose hand they started doing this back and forth. And then we moved to light tables where the light would move back and forth. Now, when I do it with clients, there's these vibrators that you hold in your hand, which I think are the best, that just vibrate left and right. But it's related to tapping, which you may have heard about too, where you can tap and you don't even have any tool. You can do it just by tapping your thighs or doing this back and forth, and it'll start that bilateral stimulation, and it'll actually be quite soothing and helpful. It's pretty cool, actually. So yeah, that's how it works. It's a really, I wouldn't call it rapid trauma resolution, but it's very fast. You can do a lot of trauma work in 4, 5, 6 sessions sometimes, and it's cumulative and it's really powerful. So I would suggest it. There are outgrowths of that. There's tapping techniques that incorporate knowledge of the different pressure points used for acupuncture, and also for tapping. There's certain sequences that I'm not up to date on, but for different kinds of conditions. So there's it's just a perfect example. And I always talk about how trauma, an effective trauma therapy can't just be talk therapy, because trauma is more than just talk. Trauma is kind of hardwired into our nervous system, and it's also a physical experience. And so any good trauma therapy has to have what we call a somatic component, a body component. And EMDR does that, somatic experiencing. There's a bunch of them that do that, but it acknowledges the need for the body to release some of the trauma that it holds. Yeah. So if you've had a massage, for example, and you have heard about it, where suddenly the masseur will hit a point and you start crying, or you burst into laughter. That's an example of how the body holds different things, and it holds trauma in just the same way. If you're interested in a book, and I'm babbling on because I'm tired, there's a wonderful book by Bessel van der Kolk called "The Body Keeps the Score," which is a beautifully written book about how trauma impacts the body.
Well, and which is why, I mean, so many partners have chronic post-traumatic distress, and like they hold it in their bodies, and they have physical manifestations and illnesses and all of these things. So for me, EMDR has been extremely useful. Some things that were really old wounds, and like I would have I would have a physical reaction to certain things. It doesn't take away, I'll still get a little triggered with that, but it's more like viewing it. It isn't the whole visceral reaction to things. But yes, the tapping has been helpful for me, and just honestly knowing that I can do it. Like if I need to do that for a few minutes, you know what, that can recenter and ground me. And what a great non-invasive tool. I also like the walking. Part of it is like like we all say, go out for a walk, go out for a run, go out for a walk, because it's side to side, and you're more likely to be looking, side to side. And I find that I process things and I'm more creative and all of that when I'm out, doing that. So somebody said, that's part of EMDR. And I was like, oh my gosh, I didn't know, but it makes a whole lot of sense too. So there's many ways to get that done. So, okay. You have mentioned before about using sensate focus to rebuild intimacy. I'm a betrayed partner of an SA who is about 8 months into recovery. We have tried to re-engage in sexual intimacy over the last few months, and I see us falling into porn sex patterns after what was initially looking hopeful. I've hinted at looking at healthy sexuality and really want my husband to explore this either on his own research or working with a sponsor or therapist to work toward healthy intimacy versus me bringing this up. I feel like I'm usually the one driving true recovery. I don't feel qualified, and I also feel so damaged by our previous sexual patterns to drive this. What would you recommend as a technique to encourage my husband to do his own research and come to the table to discuss healthy intimacy with me, or on an even playing ground?
Okay.
Thank you for sharing. That's a lot, and thank you. That had to be challenging, so I'm grateful you're here.
Wow, thank you. So let me explain first what sensate focus is, and so sensate focus is a couples intimacy exercise that was created by Masters and Johnson a long time ago, but it's still really effective. And it's a series of encounters that a couple has where they take turns, one being a pleasurer, one being the receiver. And it's basically an intimacy communication exercise. And ultimately it becomes a sexual one, but in the first few times it's explicitly non-sexual, meaning the couple is exploring, meaning basically the genitals are off limits. So the idea of sensate focus is that the pleasurer will, it's about touch. So touch, rub, tickle, pinch, massage, and the receiver basically guides the person's hand and guides in terms of touch, more pressure, less pressure, harder, softer, and try over here. And it's a beautiful way to it's a nonverbal way to start to build communication and trust and intimacy. And I've had couples who were together a long time do it and really discovered new and wonderful things about themselves. So it's a very effective technique. And it sometimes becomes sexual right away, and although it's not supposed to, but then it does gear toward sexual recovery as people begin to kind of reestablish that intimate communication that they may have lost or in some cases never had anyway. So I think sensate focus is a really nice thing. It requires trust. And this is one of the things that sometimes partners aren't ready to have that level of intimacy or to allow that person to be that vulnerable, to allow their partner back in yet. But when the time is right, it can be quite effective. And then that brings to the second part of your question, which is about how this work really needs to be a joint effort, right? And I think if one part of the couple is driving it all the time, it does get lopsided. It feels forced, and it feels kind of out of balance. So I think what I would suggest, I don't know if your husband is in therapy or not, but I think a therapist who is either a sex therapist or some CSATs have this training. I think one of the things that we're getting better at as a field, and sex therapists have been doing for a while, is really starting to integrate healthy sex and intimacy back into people's lives. I think for a long time, the addiction approach was like, just let's control this out of control behavior, and then just deal with that. And the rest of it just kind of fell by the wayside. And now more and more, we're emphasizing reintegrating and really developing healthy sex and intimacy and what that looks like in terms of being vulnerable and trust. One of the things that maybe would help your husband get closer toward that would be to look at some of the Brene Brown things on intimacy and vulnerability that might be useful for him to kind of see what some of the resistance might be, or that might be something he would work on in therapy. But I think what you might need, and this is probably not a normal therapist, but either a CSAT or a sex therapist who could maybe help guide him and then ultimately you both toward discussing healthy intimacy. You know, a lot of people don't even know what healthy intimacy is, right? And I think something that really we have to kind of break it down and look at the parts of it and see what are the essential criteria for it. And one of it is the ability to be vulnerable, right? And to have trust and to communicate. And the sensate focus exercise really does all three, but those are really essential criteria. And if for whatever reason, and frankly, men aren't as good at this as women sometimes, just in terms of being comfortable discussing intimacy and sometimes sexuality. So I think probably individual work on his part will have benefits when the two of you come together to work on it. There was one thing that disturbed me a little bit. I see us falling into porn sex patterns. So I'm not sure exactly what that means, but what I'm telling myself that means is that, and this often happens with couples who are struggling to kind of reignite something, we kind of fall back on external sources, and porn being one. And I always think it's a mistake for couples to use pornography to liven up their sex lives, because what happens is basically there's a third element in the room, right? It's the porn, and people start having an individual kind of tunnel with the porn as opposed to being connected as two people. And so I think I really we try to minimize the external tools like porn, or even the porn fantasies that sometimes help people ignite. I think it's dangerous for an addict, and I would suggest just really kind of doing more the communication. I found that just even verbal dialogue communication, checking in over time really does enhance that. And when I do assignments like that with my couples, it's you sit face to face, you hold hands, and you make eye contact. So there's no escape, right? You can't like look away, and you're really connected. And you start doing that, and it really does build up the tolerance for intimacy. And it does. People kind of try to get squirrely about it and slip away sometimes because it's uncomfortable if you're not used to doing it. So to build up the tolerance for it, I think will be really helpful.
Yeah, so the porn sex patterns, I thought, and I wasn't thinking that they were watching porn, but still the old patterns of this is what we used to do and this is how it was,
Right.
and it's that very disengaged. But what I did here is I've hinted at, so I was thinking too, the communication, and yeah, I'm sure uncomfortable to have to sit, face to face and all of that. But, we've talked on lots of the different webinars about, having a 20-minute, like a finite time. So it isn't like, oh, we're gonna talk about this for 3 hours. We're gonna talk about our relation. We're gonna talk about what we're looking for. Kristen Snowden's webinar earlier today, we talked about asking for getting your needs met. And so I would invite you to, that one's probably not posted today because Scott normally does that, but it will be posted on the sexandrelationshiphealing.com under resources and previously recorded webinars. You can find a zillion webinars on things like that, but it's going to take, I think it's going to take you being brave and be willing to step into the space and say, I need to have a difficult conversation. We're not good at this. I want to, all of those things. But it will, if you can move, if you can move the dial, it will, it will ultimately bring you closer and be worth it, so I'm really glad you're here.
And if I could say one more thing,
Sure.
I think there's a real important distinction to be made. And it's kind of the difference I talk about between healthy sex and sexuality versus kind of addictive. And I think it goes to the intention. Really. Any kind of addictive sex or fantasy is really disconnected, right? It's about getting away from the feeling, numbing, dissociating, moving off into some fantasy land, and spending time up there. And that's really very different than what I would say healthy sex and intimacy would be, which is really staying present with the other person, not often fantasy, not drifting away, not being somewhere else, but really being connected, not just physically, but emotionally and spiritually even, just to really be present and connected with all your feelings and honestly, as we all know, sex and intimacy, sometimes it doesn't go right. Sometimes it's funny, sometimes it's goofy, sometimes it's, awkward and embarrassing, and sometimes it's fabulous, and it's just real. And that's what we want. It's always not a scripted, porn tape. Yeah, enough said.
Okay, so then the next one, I think these two are together. Can you speak to the relationship between mindfulness, meditation, EMDR, and dialectical behavioral therapy? At the last Super Saturday Recovery Summit, there was an incredible speaker that touched on his work relating to EMDR and mindfulness. He also mentioned that it's never too soon to start EMDR. Any thoughts on this?
Tami, do you want to talk about that first, the speaker?
Yes, I would be happy to. So, and you can always email me at Tami, Tami @seekingintegrity.com. But on Super Saturday Recovery Summit, Stephen Danziger did a great presentation, on all of this, and it was riveting. The videos are up. There's so many. Dr. David has done one on there too. I mean, so there's a lot of great content on those. So I would invite you to do that. Dr. David's going to be way better at talking about the difference between EMDR and DBT, et cetera. But I do, the EMDR, my experience with EMDR is, you're not going to dig into all the, EMDR is not a panacea that's going to take care of all of your trauma all at one time. It was specific things for me. It's like, this is, I'm having a physical reaction to this. And so I worked on that. If I have 20 of those things, it's going to take me working on 20 different things. Maybe there's a difference and maybe it gets easier. I don't know. But, but for me, it was on this specific issue. We did some EMDR, and then, there's another thing, and we do some EMDR. So, so I don't think digging into really deep trauma, when you're, 5 minutes into recovery is a great choice. There's a time and place, but, reducing some of that, visceral reaction to things, it can be really helpful, I think. So your thoughts?
Yeah, for sure. I think, and EMDR is targeted, right? You have like you were saying, Tami, it's very specific. And what we know, the cool thing about it is that oftentimes those targets are connected. So if you resolve one of those targets, the others all resolve. And so in that way, it's quite efficient. So there's a couple of terms in here I just want to really quickly go over. Most people know mindfulness. Most people know meditation. EMDR we've talked about. Dialectical behavioral therapy is DBT is a kind of specialized therapy that was developed actually to treat borderline personality disorder, but it's turned out to be incredibly useful tools for addiction as well. And DBT basically is based on kind of toolkits. Mindfulness being one of them, but they're very applicable and appropriate skills. The ones I really like are the toolkits for emotional regulation. So it's skill-based, and I think it's really useful for addicts because we often get kind of lost up in the concepts, and DBT offers some really practical toolkits, and they're often with acronyms so you kind of remember what they are and that kind of thing. So they all do relate to me in that they look at this mind-body connection, and they are ways that we can implement that kind of start to do healing behind the scenes. Yeah, and by that I mean, if we can spend a little bit of time doing mindfulness every day, it's going to kind of work to resolve stuff that we're not even conscious of, and it trains us to start noticing things. We start to see patterns, and it's an awareness exercise, if you will, that starts to develop. So all these, what I see all these having in common are skills. They're all skill-based tools that are pretty easy to use. They're non-invasive, non-intrusive, and so on. And I can't wait to see that. I got to go back and look at that video. I didn't see that one.
I'll send you the link.
Thank you. I do want to say, he also mentions never too soon to start EMDR. My personal philosophy on that is that, just to back up a minute, addiction is all about how we cope with feelings, right? And most addictions are rooted in trauma. So most of us have some trauma of one sort or another. And our addiction, my addiction was it really served a function to keep me disconnected from all that pain. And so in a way, although it was killing me, it worked to do that. When I got sober, when I gave it up, suddenly I didn't have my technique anymore to deal with all those feelings, and they started to bubble up. They start to come up, and they're very disturbing. And because I didn't have any other way to deal with them, that was my number was alcohol. That was my strategy. So what we have to do, I think, essential in early recovery is is teach some of these skills and how do I deal with feelings that are strong? What do I do with cues and cravings that we were talking about earlier? How do I manage these things in a way that it doesn't totally throw me off balance? And that's not necessarily hard to do, but I think it's an essential step. And even the first month or two, then I think it's relatively safe to start trauma work, because when we start trauma work, by definition, we're drilling down into that stuff. And although every therapist tries to make it as comfortable as possible, trauma work by definition involves a little bit of pain because there's some feeling of emotions that we want to feel and release. You know, the point is not to get mired in them, but to really move them and get rid of them. So I think once a person has those kind of skills, then trauma work is fine. The one exception to that, and this is we do at Seeking Integrity, when we start to do EMDR with any client while they're with us, and it's very early on, we do that resourcing, it's called. Where resourcing is an essential part of EMDR that you do before you start working with a client on EMDR to give them just those skills. Okay, if I get really overwhelmed with, you know, sadness, what am I going to do? Or grief, or whatever it might be. And once they have those resources, then that's fine. And EMDR does have the resourcing skills, and I think it's never too soon to start that. But I would be cautious about digging into trauma too soon. I've seen too many people relapse because well-meaning therapists went after trauma too soon. So
Yes.
just be cautious.
Yes. Work with a professional who understands addiction, please. Okay. Next question. Last week you mentioned a dopamine chart that you were going to try to put out. Is there any way I could get a copy? Do you have that?
I do have it. I'm trying to figure out how I can.
You email it to me if you're looking for it, Tami, Tami at seekingintegrity.com, and I will field those. So you send it to me, and I will send it to whomever asks.
So I just shown it to our clients, our inpatient clients today. It's a pretty dramatic idea about what so-called natural rewards we get from dopamine, belonging and cooperating and having good food and having sex without drugs or addiction. And it shows how much dopamine is released with that. And then the difference with like cocaine or even nicotine or methamphetamine particularly, just off the chart. So yeah, it's a visual impact, but I will send it to you. And
and I think you shared that in the Super Saturday Recovery Summit, because again, if you want some of those videos, you know, we did one with Todd Love on ADHD. You know, Dr. David mentioned that earlier. Lulu Cook, I talked about that with food. There's, you know, we have, that's a whole nother topic and we're running out of time, so I won't take more time, but please, you know, check those out if you are interested. Okay. What are signs of an SA or PA that is in recovery? What does that look like?
So I would say basically some humility, some empathy, the ability to feel. I think when we see an addict who's not in recovery, they're can be pretty icy. They can be pretty much self-righteous. They can be pretty narcissistic. They can be pretty demanding. They can be pretty
blaming.
Yeah. So I think when we
angry,
who's humble, who takes responsibility, who is vulnerable, who has feelings, who expresses feelings. I mean, I think it's almost you can almost feel it as opposed to seeing it. You can feel when somebody's in one state or the other. But I think, yeah, just that ability to kind of be relatable and not off-putting for all those words Tami and I just mentioned. That's a clear way.
Yeah, dissociated. I mean, you know, it's like, you know, if somebody is 4 days looking at, you know, at probably, I would classify that as porn, but there's lots of different at things that are probably secretive and he's lying about it, that would be like dissociated and all of those type of things. So read out of the doghouse. You know, here are the things to rebuild trust. If you start seeing, you know, that those breadcrumbs are getting closer together, that's a good thing. You know, people, I've had multiple partners who've reached out to me not too long after their loved one was at our program, and they have said, I know it's early, but I can see the change. That, I mean, you can see the change. As a person in recovery, we start to feel the change. We're more aware. We're not just like all closed up in our little, you know, me. You know, we are looking to engage in a different way. So, okay. last question, how important is it to be able to identify the trauma that you must have suffered as an addict? For example, as an adoption, you don't remember being separated from your birth mom, or there was sexual abuse at a young age and you don't remember, etc.
So great question, because very often with trauma, especially at an early age, there is no memory of it. And that's where some therapists get in trouble kind of fishing, which we never want to do. But I think oftentimes we look for signs of trauma kind of indirectly, right? First of all, is there addiction? How does someone process feelings? Do they kind of disconnect or dissociate from issues or people? There's kind of certain patterns that indicate that. Very often, I think when there's a case like this where, gee, I must have suffered trauma, but I don't know what it is, I would look to neglect, because neglect is something that we know causes trauma. Then by neglect, it's confusing because you can be materially, you're going to get Enid's book. Yeah, perfect. I was going to talk about.
Hang on.
It went into your background.
I was going to say there, Neglect the Silent Abuser.
Right, Enid Gray, a colleague of ours, is a wonderful book. Neglect. Our friend Scott, who does this webinar, talks about his own case where his family had money, he had a car at 16, he went to college, there was always food on the table, he had clothes. So there's no neglect there. The problem with neglect is not about physical or material things, it's about emotional, what we call emotional attunement, where parents are basically disconnected from the child. They may provide materially, but if they're not emotionally present consistently, that's a problem for a kid. And so a lot of addicts may have parents that were just detached or inconsistent, or a sibling maybe who a chronic illness that got all the attention, and I was kind of over here doing my thing, being the best little boy in the world to not make any trouble for my family who were dealing with my sister or my brother. So all that stuff, neglect often is a case. The other one that we're finding is not major trauma per se, but chronic low-grade trauma like bullying or harassment. Those kind of things added up over time can produce the same kind of traumatic reaction as major, physical or sexual trauma itself. Yeah.
And the continuation of the question is, how important is it to identify? I picked up a multi-decade chip recently, and when Enid's book came out in the last year and a half, something that I could not have identified, but it was neglect, because same like Scott's story, I had parents that cared for me. I had a sibling that was, physically disabled, and through no fault of anybody's, the attention needed to go in that direction. So there wasn't bandwidth. And so for me, that was not identified until, a year and a half ago. So can you heal and be in recovery? Yes. Is recovery and ongoing peeling of the layers and more discovery? Yes. And so just being open to it, I did EMDR for the first time, I don't know, in the last 3 to 5 years, and great. There was old stuff, but have I been a mostly functioning human being for a lot of years? Yeah. Have I been grateful for my recovery? Yeah. So it isn't like, oh, within the first 30 days I have to identify and be able to name. Most of the guys that come to our treatment program are like Scott and me. We're fine, we didn't have anything. And so it's challenging, but being open to it. And I wanted to, like you mentioned, adoption. Troy Love does the 4th week of the month on Wednesdays, and he has talked specifically about that. He was adopted, and he talks about, the abandonment wound, even though, it was in your utero, and then he's, pulled apart. He has Finding Peace, which it talks about attachment wounds, and his workbook, and he does a men's group on Fridays on our site. I would invite you to explore that. That may be something useful as well. So great questions. Thank you, Dr. Dave. Thanks for showing up for sure. So yeah, it was great to see you. Yeah, so I don't get to do this very often. So grateful. Thank you so much. Thanks to everybody who joined us. And Scott, I think we'll be back next week, but join all the other webinars and things too. Take care.
Okay, thanks,
Bye-bye.
everybody.